Good morning, everyone. We want to welcome you and thank you for participating. This is a Zoom that is part of City Hall's ongoing effort to communicate with our business community. I'm Eric Dysart. I'm in the City Manager's office here at City Hall. And we've hosted webinars like this for retailers, restaurants, schools, manufacturing, all in Pasadena. And today we're going to welcome you as we focus on the medical and dental office community in Pasadena. And we want to thank you for a wide range of important services that you provide to Pasadena. It seems like this health crisis has created a significant disruption to your field, and we want to try and support from our perspective of local government. But I want to thank you for your service and commitment to both individual and community health. So as you're well aware, the county still has a serious health crisis underway with over 64,000 cases and over 2,500 deaths. So we do still want to take this very seriously. And we want to share relevant information with you that's up to date and want to share what we know. So as far as just protocols for this Zoom meeting, we want to have you ask questions. If you have comments also share with us that you feel are important for the dialogue. We want you to raise your hand as part of the Zoom platform. You can do that with clicking raise your hand, or if you're on the phone by hitting *9, and we can get you involved in a chat. And the chat space is also involved or part of this too. So if you want to jot down a comment in the chat, we'll have someone here kind of pose that question, and we'll try and respond to it. But I'm not the star of this show. I want to introduce Dr. Go, who's our Director of Health here in Pasadena. She's our superstar, a Stanford and UCLA experienced physician, but she's been managing our office here for a couple of years, but more importantly through this ordeal of COVID-19. So I want to introduce Dr. Go in a moment, but also as I am looking at my reminders here that this is a business briefing specifically to the medical and dental community, and that this is not for any member of the press. So all your comments are off record, and any members of the press that might be part of this, we ask you to disengage and get in contact with us through another process. Through our public information officer at the city manager's office. So with that, I'm going to introduce again Dr. Go.
Thanks, Eric, and thank you everyone for attending. I want to welcome you to our conversation, because what I'd really like is to have this conversation and for us to have most of our time spent with answers and questions and answers not just from public health, but really you all as experts in, as you've opened your offices and practices and implemented some of these risk-lowering measures to share with others who might be on the call. I want to introduce Vivian Gonzalez. She is our nursing director and also division manager in our public health department. And she has many, many years of clinical outpatient experience, so I know she'll be able to weigh in as well when we answer questions. So just a few background remarks. Our case counts for today in the United States, as you know, we're over 2 million cases, and we are have the dubious distinction of being #1 in the world in terms of number of cases. Unfortunately, we have over 110,000 deaths in the United States, and in California, it breaks out as 130,000 cases and more than 4,700 deaths. Locally, LA County accounts for more than half of or nearly half the total case count for California. It's at 67,000 cases and over 2,700 deaths. And it has to do with the fact, certainly, that we have such a large population, and also the density and nature of the way we live and move in Southern California. In Pasadena, I want you to feel welcome to access our dashboard anytime on our website. We have daily updates to our case counts and our other epidemiological measures that we publish publicly, we have 1,015 cases currently and 84 deaths. And the trends we've been seeing is really a flattening and a testament to the success of the safer at home orders and the efforts that all of you have made to make modifications to your activities in your daily life and your professional life. And so we've seen the benefit of that, which was that really the daily incident number of cases has flattened. We've been pretty steady at about 9 new cases a day. And we haven't had new deaths for several days. And really the population that accounted for our deaths largely reflects the characteristics of the coronavirus, of the novel virus, and that is that it has the highest case fatality rate, highest morbidity among our older community members, people 65 and older. And for us, of course, with every decade of age, we see a higher case fatality rate. And most of our cases, the vast majority, had underlying health conditions. The ones we saw the most were hypertension, diabetes, and renal disease as underlying medical conditions. And many of our deaths were among, unfortunately, our residents of our congregate living facilities, our skilled nursing facilities. So we can talk about healthcare. The healthcare throughout this pandemic, in terms of the health officer orders, has been considered an essential service. But the way things happen is that in the city of Pasadena, we have our own public health jurisdiction, and so I have the legal authority to issue health officer orders, which I have done, starting with our emergency declaration back in March, public health emergency. And however, the state health officer supersedes in her orders every jurisdiction in California. And so since the Safer at Home order started, I think that was March 19th or March 22nd from the state, we have gradually seen a loosening of those measures because we were able to stabilize our demand on ICU beds and ventilators. And so we've had this gradual increase, not as gradual as I would like, but a gradual increase in opening of economic activities. And that included really early on the opening or allowance for healthcare services that were not elective to proceed. And that was in recognition that frequently elective services or procedures become non-elective if they're delayed, and that the healthcare needs of our community needed to be met. So for many weeks now, doctors' offices and dental offices have been allowed to open, and the current guidance is that the guidance that is provided by the CDC and by your respective professional organizations. We do not have any stricter or more specific guidance at the local level. However, we certainly do have information for you about when you have cases, because your Pasadena Health Department, if your office is in Pasadena, is in our jurisdiction, and we manage your case investigations, your worksite outbreaks, and any patients that you might have with COVID-19. So the recommendations that I have reviewed are can be organized in a couple buckets. Mostly we're looking at employee and staff safety to begin with. And we have a couple guidances that are specific to different settings, like retail settings, but also offices. And to the extent that they are applicable to you or useful to you, I would recommend that you use them or offer them to you. for those types of businesses, we require them to follow the protocol that we've published. It's on our website for their industry. And if you find that checklist useful, then please go ahead and use it. Some of the items I think that are useful in clinical settings are, first of all, that you should designate a single individual who does not have a full plate with other duties, and sometimes that means hiring a consultant or bringing on someone else to be the infection preventionist, to be in charge of the getting your office set up. And you may have already done this. I know many offices have, but getting set up to follow protocol, to research the protocols, follow the protocols, implement them, make engineering changes in the environment, in your workspace, implementing and posting, and also educating employees and staff, and then your patients on what the modifications are going forward, and that the way you were doing business before is not going to be the same as the way you're doing it now during the COVID-19 pandemic. So I would I want to share some of the insights of what we've seen in terms of offices, but also in healthcare settings, that the types of disease transmission we're seeing are not just in clinical interactions, say patient-doctor, but also in the social interactions between the people working in the office. And so where you might let down your guard might be in the break room, or on breaks, or before or after work. And that I just wanted to offer that as the fact that we've seen this to be one of the weaknesses in terms of infection prevention, and to take that into consideration as you create standards for your employees in your offices. I would also consider outside contractors that you bring in. We've seen an outbreak in a clinical office that was as a result of some contractors and some work that was being done in the office. So definitely take that into consideration. Of course, universal masking should be happening for your staff and for your patients. And for your patients in your waiting room, first of all, that we want you to reduce or maximize physical distancing. And so you'll make changes to your procedures as far as your waiting room or any queuing or the services you're providing at the front window. But do post signs that set expectations for your patients so they know what those expectations are, and inform them ahead of time. Do the screenings that you want to do by phone. I went to the dentist recently, and they provided a list of new procedures and expectations by email ahead of time, so that I knew that when I arrived, I would get a temperature screening. And I brought my own thermometer, so I did it myself and showed the nurse the temperature, and knew to wear a cloth face covering. And the office also provided masks in case the patients forgot or didn't bring their face covering. And that really is for protection for your staff and for yourself, so that we're providing source control, and that you can reduce your exposure to the patients. The resources, so I mentioned both resources from professional organizations and the CDC, and I've seen more useful guidance come out as time has gone on. We would like to provide, we're working on putting a lot of these links on our website, so that I thought there was a very good presentation for dentists that was provided by the CDC. And because we have a community oral health program in normal times that tries to increase access for kids to oral health services, we do have staff who are getting these resources from the state, and we'll compile them and try and make them available to you on our website. Reviewing the CDC guidance. So one of the other topics that we have encountered with our offices in the city is this issue of managing visitor access and movement within a facility. It's something that you might not think about, but a lot of doctors' offices are in buildings. And so it's important to make sure that when your patients are coming in, from the very beginning of the point in time they arrive in the parking lot and walk through that front door and then take the elevator and get to your office, that they are following the same kind of requirements that you would want in your office, which is universal masking and physical distancing. So just to put that out there as something to be aware of. I think, and we can move to questions, but I think that with some of the questions I've been getting have been projecting forward, and it's extremely difficult, as you know, with a novel pathogen that we've really only known about for 6 months, that we're getting new data and changing our protocols and our policies and changing our public health interventions as we get better evidence. It's hard to predict where we're going to go in the next few months to a year. I think that with the reopening and increased person-to-person interaction, we are expecting, and we're closely tracking cases and hospital utilization to monitor in a not as precise as I would like, because we've piled on many different openings, and that is the result of really the devastating social and economic impact we've seen from coronavirus, and recognizing that we're trying to balance the morbidity and mortality impact with the social and economic impact. And so the measurement of exactly what the impact is from each reopening is not going to be as precise as I would like, but we are following and surveilling to the best that we can. And I do expect that we will see an increase in cases going forward. We haven't yet. We were really starting to track beginning Memorial Day weekend, because that was when we really saw a lot more public activity that was concerning. And here, I only have jurisdiction over the city of Pasadena, but also in LA. We haven't really seen a huge surge in cases yet. However, we are seeing an increased demand on our healthcare system in certain hospitals in the county, not so much locally, but that is going to be one of the important metrics that we follow that might impact what medical services can be provided. So this question of, as we have an increased demand from COVID on our healthcare system, it might trigger some reduction in our ability to provide other services as we find the need to increase our capacity in our healthcare system again to address COVID cases. So with that, I'll just see if Vivian has any comments for the whole group, and then we can answer some questions.
Good morning, all. Thank you, Dr. Go. That was very comprehensive, and your approach and overview. Just some other, I think, words of wisdom that we have identified is to reiterate that this is an ongoing process. It's a very new disease. And what we have seen in facilities is there is a lot of staffing turnover. And so for that purpose, it's really critically important that you have documented processes to follow to ensure that staff are supported. So you will find yourself immersed in consistent and always training and ongoing support. So I just wanted to touch on that. And as you mentioned, Dr. Go, we're here as the health department to provide support, guidance on our protocols, and know that we're available at any time. So with that said, I'm open to, again, questions on how we can help proceed or move forward.
Thank you, Vivian. So I want to remind everyone that using the chat function for posing any questions or comments or raising your hand, we're happy to kind of go through those. And also want to introduce David Reyes, who's our Director of Planning and Community Development. He's had an active role in helping with all sorts of activities related to this crisis and making sure that we are responsive, particularly to the business community. So he might be jumping in with different comments too as questions are posed. David, did you have anything to add in the meantime as far as some comments before we go to questions?
Just very quickly, so everybody knows, as they seek to implement measures to protect yourself, your employees, and actually your customers, we've seen a lot of different businesses look to plexiglass and other forms of barriers, physical barriers. None of those things need building permits. I'm going to just be very upfront about that. Those are things that you'll need to do depending on your setup, your system, and what your individual office needs are. But I want to be really clear that those things 99% of the time will not require a building permit, but we are here. Even though we're not open to the public currently, we're working on reopening as well. But we are still here in the office working and are prepared to answer those questions. And then the other part of my department's function is code enforcement. And as Dr. Go stated so eloquently, one of the challenges that we've had is not necessarily patrons or customers or patients within the building, but as they come and go, leave and exit, whether they're in common spaces, hallways, elevators, we've received numerous complaints about patients not following physical distancing and or the face mask requirements. And those are things that we would really want your help on to stress, whether it's signs, whether it's something on the website, talking to your patients before they come into the office. That would help us because our staff, we don't want to go out and regulate how you're keeping your patients safe, because we feel confidently that working together you will be doing that already. So I think with that, Eric, likely that's going to be the end of my role.
All right,
Thanks.
so now we're going to open it up for questions, and Michelle's going to help me here with managing those. Michelle Garrett.
Good morning, everyone. We have several questions that have been queuing up that I'll go ahead and ask out loud. The first question is in regards to patient testing. Is there information available about ongoing number of tests done within Pasadena to evaluate the percentage positive here in our city? Dr. Go or Vivian, could you tackle that one?
Yes. So we have been tracking on our positivity rate for a couple of reasons, but in the beginning, I'd say at least 6 to 8 weeks ago, our positivity rate, meaning the number of total tests done in Pasadena that were positive or done for Pasadena residents that were positive, was 30% or higher. And that was because because testing was limited, availability of tests was limited at that time, and we were doing very intensive outbreak investigations in our skilled nursing facilities and utilizing all of our public health testing resources, including the swabs, which were hard to come by, and the lab capacity, which was hard to come by, to stop disease transmission in SNFs. And so many of those folks, unfortunately, were COVID positive that our positivity rate was very high. So it was our goal to drive down that number to the extent that that is an indicator of broad-based testing. And so we've been successful in doing that thanks to many different sources of resources. Right now, both county, city, and the Huntington Hospital donating resources to get our community testing sites up and going and having them available for quite some time. Currently, our positivity rate was low enough to qualify for the governor's variance in his order, which was that we could go ahead and reopen some other businesses. And so our day-to-day positivity rate is anywhere between 12 to 14%, but looking over like a 1 week period, it was below 10%. So which we thought was a really good sign, because the number of tests that we've been doing has gone up in the thousands. We've only been able to test about 5% of our population, and so we would want that to increase. But people are now getting multiple tests because getting a point-in-time indicator, PCR, only tells you information for that single point in time. So there may be other exposures or reasons for particularly healthcare workers to be tested more than once. And so the numbers will be a little bit murky going forward, but we are going to still try to increase our testing overall for a population. I want to make sure you know what the testing resources are. It's available on our website, so you can direct any patients or your staff to our website to find those links. But there is a free testing site on Lake Avenue, North Lake Avenue, at the CHAP Care Clinic that is funded by the state. And that is hopefully going to continue for quite some time. And that, I believe, is not full to capacity. So there are appointments available there, and I encourage you to send people there to get tested and to have a lower threshold than before. Before, we were really requiring people to be symptomatic or to have certain characteristics that were higher risk, depending on your profession. Certainly healthcare workers qualify, but as we learn more about asymptomatic transmission and we learn more about, and we have more testing capability, I'd like to encourage people to go get tested and for you to pass that message along so that we can hit our capacity for testing. And in the private sector, commercial testing, there are a lot of urgent care facilities that are testing. A lot of doctors' offices are able to do this now because they're able to get the PPE that they need and set up the systems to keep risk low for their staff while they're collecting the respiratory specimens. And then CVS is over in East Pasadena is doing a drive-through window with self-collection, and they can bill insurance to do that. So I want to make sure that as our resources for testing increase, that you're able to refer patients and your staff to those places.
Dr. Go, may I add, also Dodger Stadium is also an option. They have almost up to, I believe, 1,000 to 6,000 capacity a day for testing. So that is also another viable option.
And that is free, and it's at the link is on our website, but also LA County, COVID-19.lacounty.gov has a list of free testing sites across the county.
Yes.
Thank you, Dr. Go and Vivian, for those responses. We're getting lots of questions about PPE. The first one is this particular caller-in has noticed some of their patients coming in wearing a 3M N95 mask with a one-way valve. Will that actually be a higher risk for transmission? So
I don't think there's a way to quantify that it would be a higher risk, but I think that is inadequate protection for source control. The official CDC statement on their website is that it may not provide source control. And so my recommendation is that actually a medical grade surgical mask or it's not quantifiable whether it's better or worse than a cloth face covering, or at least it hasn't been quantified at this time. But when I see someone with a one-way valve, that makes me unhappy about what protection they're providing to me. And I would prefer that person to be wearing a solid mask that doesn't have a valve.
Thank you. The next question is, if a patient becomes positive within 2 weeks of their dental appointment, and staff has proper PPE, what is your recommendation as far as notifying other patients if physical distancing and face masks were worn?
So I would want to get a phone call at our or an email to our communicable disease investigation team to investigate and determine whether or not there was an exposure that happened. If that patient who became positive is a Pasadena resident, then I should be getting that lab result from the lab. But even if that wasn't a Pasadena resident, you should give us a call so we can help you manage and determine who might be a contact and might have been at risk. And if there were other patients, if we assess the situation and you tell us where those patients were located and how much time they might have been in contact with each other, and the same for your own staff, then we would help you identify who you need to contact, and we would help you contact them as well.
And what number would they call, Dr. Go?
So the nursing phone number is 626-744-6089. You can find that in any of our business protocols. And the email is nursing@cityofpasadena.net.
So that cityofpasadena.net website is the city's general page, of course, but there's a large COVID button. So there's various resources for the business community for you to take a look at. I would recommend that those of you who are participating today at least check that out. Next question.
Sure. So just a reminder, folks, if you would like to ask a question, you can either type it into the Q&A chat function, or you can raise your virtual hand. From a computer, you can do that by looking for the Q&A and raising your hand in the Zoom ribbon. Or if you're dialing in, you just hit star 9 to raise and lower your hand, and then star 6 to mute and unmute. Our next question is coming from Carla. Can medical spas start providing elective procedures such as Botox, fillers, lasers, and facials? Dr. Go or Vivian?
So certain face-to-face cosmetic procedures are still not allowed at this point in time. And one personal service, such as nails, is not allowed. And I would have to check specifically, and I will check for you if you give us your contact information. Because we are still under the state health officer order, we would have to check specifically on the procedures that you listed. It is my understanding that at this point in time it's not, but I will confirm for you and get back to you just in case the state has made an allowance for those.
Thank you, Dr. Go. The next question deals with centralized air conditioning. For office buildings with centralized air, but without windows that can be opened, what are other possible ways to reduce risks of COVID transmission?
So it's a good question. I think as we learn more about this virus, we will know more about the theoretical risk of aerosolization and aerosolized transmission. At this point in time, when we're not using or doing aerosolizing procedures, just in terms of respiratory droplets, the transmission is still, the evidence is still showing that it's primarily through respiratory droplets. And for that reason, we don't expect that respiratory droplets can travel through an HVAC system. However, I also recognize that you are doing some procedures, like in dental offices, that might cause aerosolization. And so I've seen that the Dental Association has provided some information on, for your office, different methods that you might implement to try and reduce that risk there, in addition to full PPE for those who are within a distance of that patient. There have been, so you can consult with industrial hygienists. There are people who have been looking specifically at this issue. And there are some recommendations I've seen, such as installing certain HEPA grade filters in HVAC systems. And so those are considerations that you could implement, measures that you could implement, but I don't have data really to support exactly what you would do. So you'd have to check the literature or consult with an expert on that in particular.
So we do recommend that if you are a tenant in a building, that you at least have a conversation with the property owner or manager on making sure that you understand what they're going through as far as shared space and cleaning protocols. And so that at least could have a conversation with what might be a concern of yours, or at least an understanding of what the building itself is doing for a shared space. Next question.
Sure. So CHAP testing is state funded. Are other free sites in LA County free, and will they exist past this summer? Barbara Ferrer suggested in a telebriefing in May that the free county sites would likely disappear in the fall. Dr. Go, do you happen to know?
So the Dodger Stadium site, for example, is a county-funded site, and we have seen that the decisions, if Barbara Ferrer says that they might disappear in the fall, then they might disappear in the fall. I don't have control over the funding for those, but I have seen that they're really trying to push testing to be in our healthcare system so that it's sustainable, because the current model is not sustainable. And really what it involves is the complexity of our healthcare system, where the payers are our health insurance companies, and that is where the revenue stream should be coming from, as opposed to public funds just poured into testing, into providing a healthcare service. So I think that's why she made that statement, because they are trying to get testing incorporated and sustainable in our healthcare system.
Great, thank you. Do hospitals operate under guidelines from CDC and professional associations?
So hospitals have a lot more regulation than doctors' offices. They operate under their license from the state, and they operate under the jurisdiction of the CMS, the Centers for Medicare and Medicaid. And are highly regulated as a result. So yes, they are to apply, and certainly our hospital in Pasadena, Huntington Hospital, utilizes the latest and best guidance from the CDC, and also certainly infectious disease organizations and experts as they find and find new research and new information, and then they have to comply with state and federal regulations as well.
Great, thank you. The next question I'm going to direct towards David. If practices, medical offices need to reconfigure floor plans, do they need to submit that to anyone in the city?
Yeah, typically any TIs, forgetting this situation, any normal TI that comes in that involves a floor plan remodel may require a building permit. But if you're just moving cubicles around and or installing non-bearing partitions, et cetera, those wouldn't normally need a building permit. They don't need one now. I'm happy to leave my email so that folks, if they have a specific question, they can or they can give me a call and we can get them through it. In most instances, Michelle, minor office configurations to address the need for physical distancing and or other protocols related to health safety will not require a building permit. But with that, I think it's important if people have an exact question, we can work on that. And I'll just leave my direct number here on this call. Thank you.
Thank you, David.
I will mention, Michelle, that as we're writing our protocols, we want people to keep in mind if they do make modifications to take into consideration fire code and fire safety as well as accessibility guidelines. So just to keep that in mind.
Thank you. The next question is, if there is a second wave of a COVID outbreak, will businesses need to close again?
So I don't really think of it as sequential waves. I think of it as we're just going to be seeing increases and decreases, and I think it's going to be ongoing over many months. And I think that because at this time, the only tools we have are non-pharmaceutical interventions, because we don't have a widely available effective treatment yet, although the remdesivir trials are promising, and we don't have vaccines yet, that the only way we can mitigate the impact of COVID-19 is through what we call non-pharmaceutical interventions, which is only a fancy name for keeping people distance from each other. So I think that we can't predict what the behavior of the virus will be, to what extent it will surge, and if it exceeds our ability to certainly our hospital capacity, then we would expect that we might have to rely on some of these NPIs or non-pharmaceutical interventions again, which would include the spectrum of what we've seen already, what we've used already, which is really restriction of movement and restriction of social and economic activities.
Thank you, Dr. Go. As a reminder to all of our participants, you can ask questions one of three ways. You can either type it directly into the Q&A chat, or you can raise your virtual hand. From a computer, you look for Q&A and raise your hand in a Zoom ribbon. And if you're a dial-in participant, just hit *9 to raise and lower your hand, and then *6 to mute and unmute. So our next question is, it's actually for Dr. Go or Vivian. Do you feel that contact or non-contact forehead thermometers are better screening devices for COVID?
I'll let Vivian answer too, but I prefer non-contact because then we are reducing the potential fomite transmission. Although we do know we believe that respiratory transmission is really the primary route. However, when I use my non-contact forehead thermometer, within 60 seconds, if I take my temperature 3 times, I get different temperatures every time, and they can range, to half a degree to a degree difference. So I know there's variation, and that's why sometimes in our protocols you'll see that we're using a cutoff point of 100 degrees, not 100.4, because really 100.4 is a core temperature, and no one's doing rectal temperature screenings. So I think that there's just the purpose of the screening is not so much a medical determination as it is a screening tool, which means that it raises a flag, and if you should err on the side of caution that if someone is getting towards something that you're worried about as a fever, that you would have them stay home. But Vivian, maybe you can talk, do you have any experience with types of thermometers and what might be better?
Well, during this situation, absolutely. I believe, again, non-touch thermometers are definitely recommended, but as you mentioned, Dr. Go, that is not only the only mode of questions. They should also be doing symptom monitoring checks, which again ask questions specific to history, cough, respiratory distress, shortness of breath. So you're doing other checks to ensure that the accuracy or negate any fever.
I think 20% of folks in some studies, certainly the large study that came out of China, did not have fever that met the definition of a fever.
That is true.
Thank you, Dr. Go and Vivian. Our next question is regarding PPE for mental health professionals, psychiatrists and therapists, for example. Do they need hospital-grade masks, or can they use cloth masks?
Good question. So first and foremost, I would still advise all services that can be provided remotely, even though I know the quality of the service may not be as good, but for safety reasons, I think to try and encourage you to continue all remote services as much as possible. It might be interesting to consider if you're able to create an environment where you're more physically distanced, and a cloth face covering might be sufficient for a conversation if you were separated enough and if there was good airflow, for example. And since you won't be doing any procedures based on the current CDC guidance, an N95 is not what's recommended unless you're doing an aerosolizing procedure. If you are able to wear a medical grade surgical mask, if there's ample supply, that is an option for you. Yes, so I think those are all considerations, but also just to make sure that you check on the CDC website, because there are changes. They don't announce their changes, and we go back from one day to the other, and we realize that there's been an update on the CDC web page based on the evidence that they're reviewing and what they're learning. So do check back regularly.
That's good advice. The next question we have is in regards to practices that might take walk-in type appointments. Are those allowed at this time?
It's my impression that they are allowed, but again, some of the problems we've encountered are if you don't have staff managing queuing, managing the people who may be in line or waiting for service, then it causes a problem. It causes a gathering, and that's when the disease transmission risk occurs. So if you are able to do what you've probably seen at grocery stores and have someone on staff who is monitoring that line of people who are waiting, then that is an option at this time.
Thank you, Dr. Go. Looks like we have maybe two more questions. The next one is, how much time should practices leave in between booking their clients? So in between clients, how much time should they account for?
I think the guideline to use is how many people you can have while maintaining physical distance and low risk in your setting. So if you can, for example, at my dentist, if they could manage one patient at a time and then have the next person come in and start getting ready while the other person is finishing up and leaving, and they could still maintain physical distance, then that would be okay. So I think it's not about an absolute number, but really about your space and your staffing, so your ability to manage people and to avoid like large crowds in your waiting room or in your office.
Thank you. We are actually getting a few more questions now. What is the COVID capacity at Huntington Hospital?
So they have 70-some ventilators, and I don't know what their number of ICU beds is, but they have, in response to the state's request of all hospitals to increase their capacity by 40%, they were able to reduce their elective procedures and increase the space on their floors to dedicate to COVID or higher level care that might be needed. And so I don't know the current status right now, but they also had a mobile medical unit they were able to request and receive and set up outside the hospital. And again, I'm not sure today what the status is of that, but it was a very impressive facility that extended the availability of their resources.
The city and Huntington Hospital also worked as a contingency to get additional beds set up at the convention center. So that was in place for much of April and May, even though that's going to fortunately be kind of taken offline because it was not needed. But that was another kind of resource that Pasadena had available as we weren't certain how bad this would be. So I believe, Dr. Go, that those are being dismantled even right about now.
The end of June, yeah. Oh, I guess a couple more weeks.
Yeah, okay. Next question.
Great, thank you. So this particular participant today has a team of therapists that works with small children and cannot maintain 6 feet distance. The sessions generally involve talking, playing, and exercises that are not medical procedures. Are cloth surgical masks appropriate, or do therapists need N95 or KN95 masks?
So the CDC guidance currently would say that you're not doing aerosol generating procedures, so a cloth face mask or surgical mask would be sufficient. But that would mean that the child, and this is the hard part, as we try to think about how we're going to have schools and day camps this summer, but that the child, to the extent possible, certainly not under the age of 2, its face coverings aren't recommended, but for older children, that they try to wear that as well. So in this case, I think that the pre-screening for both staff and clients or the children would be an important component to try and, again, reduce your risk.
Thank you. Our next question is about physical therapy clinics. They have patients in the over 70 year of age category who want to return to in-person visits due to gym equipment access within the clinic. Should patients be wearing masks during cardio exercise? What is your advice for us being in the gym when gym goers are exercising without masks?
So the first thing you need to do is reconfigure your gym so that there can be the more distance, the better. We say 6 feet, but really that's for people at rest. And we know that if you're increasing your respiratory rate and your exertion, that potentially respiratory droplets could go further. You'll have to consult with each individual's doctor as to whether or not a face covering would be advised during cardio, because we know that people with underlying medical conditions or we do worry about, I think, decreasing their oxygenation with a face covering and what burden that could cause. Certainly with N95s, we've been concerned about the lay public wearing N95s because that decreases your intake, your air intake even more. So you'll have to go on a case-by-case basis, and I would recommend a clinician make that decision for those individual patients. For when you're in the gym, I think that everyone should be wearing a face covering. The benefit, again, comes from everybody wearing it and protecting each other. And then making sure that your disinfection procedures are increased and that you're sanitizing the area, the machinery, and the surfaces all around more frequently than before.
Great. Well, with that, we're kind of winding down to the top of the hour. We want to thank all of you who have participated. Encourage you to look at the city's website to make sure that you're aware of any updates that are occurring. We want to thank Dr. Go, Mr. Reyes, and Vivian from the city of Pasadena. As you can see, we're taking this very seriously, but want to make sure that we are here as appropriate to provide services to our business community. So we want to wish best wishes to all of you as you confront this challenge. And again, make sure that you contact any one of us if questions arise. And want to thank you once again. Take care.